everyone. So let's discuss certain questions of INICET pharmacology which we have recalled. The first question is match the following antimicrobial against the specific infections. So let's see what is the answer for this question. Now the first option is metronidazole. Remember, metronidazole is the drug of choice for anaerobic bacteria. And which bacteria is anaerobic? Bacteroids is an anaerobic bacteria. Okay, so we can easily remember. Now, what about vancomycin? Remember, we all know that vancomycin is the drug of choice for MRSA, that is methicillin-resistant Staph aureus. Now, many students found difficulty in two options, ceftriaxone and imipenem. Remember, ceftriaxone and imipenem, they are both given for gram-negative bacteria. They are both given for gram-negative bacteria. Klebsiella is also a gram-negative bacteria. Haemophilus is also a gram-negative bacteria. Now, which agent to choose? Remember, if a bacteria is resistant, then we use imipenem. If a bacteria is not producing any resistant factor, then we use ceftriaxone. Okay, so remember, Klebsiella is known as a very resistant bacteria. Resistant bacteria are known as superbugs, because it produces an enzyme known as beta-lactamase, and beta-lactamase degrades beta-lactams. Ceftriaxone is one of the beta-lactam. Hence, for beta-lactamase producing bacteria like Klebsiella, the drug of choice is imipenem. So what the option is remaining? Ceftriaxone. Ceftriaxone is given for Haemophilus influenza. So as simple as that. Now let's come to the second question. Which of the following is incorrectly matched antidote? Now let's see from the last option. First is hydrofluoric acid. Hydrofluoric acid causes burns. And for burns, remember, why burns? Because of presence of fluoride ion. That fluoride ion leads to burns. Remember, this fluoride ion can be sequestered or removed by calcium. Hence, we generally apply topical cream of calcium gluconate, and in resistant cases, we give intravenous calcium gluconate for hydrofluoric acid burns. So the fourth option is true. It is correct. Valproate. Remember, valproate leads to increase in ammonia level in the body. And remember, carnitine helps in removal of ammonia from the body. It excretes ammonia out of the body. Hence, for valproate induced hyperammonemia, the antidote is again levocarnitine. Then we have ethylene glycol. Now, if you talk about ethylene glycol, all word is coming, it must be some alcohol. Ethylene glycol, it forms inside the body. It first forms, remember, you will write formaldehyde inside the liver. It gets converted into formaldehyde with the help of an enzyme, alcohol dehydrogenase. It also forms various other metabolites like glycolaldehyde. Now remember, among them, glycolaldehyde is the major metabolite of ethylene glycol. After that, this glycolaldehyde gets converted into glycolic acid plus oxalic acid. These are the two isomers of each other. Okay, and it is converted by aldehyde dehydrogenase enzyme. Now, one question which lingers in our mind is where these enzymes are present. These enzymes are present inside the liver. And these two compounds, glycolic acid, oxalic acid, glycolaldehyde, they are highly neurotoxic drug. They are highly neurotoxic molecule. They cause brain damage, eyes damage, and oxalic acid leads to oxalate stones in kidney. So ethylene glycol poisoning is a very severe poisoning. It is used as an antifreeze. So how we can prevent ethylene glycol poisoning? We can inhibit this enzyme, alcohol dehydrogenase enzyme. Hence these molecules will not be synthesized, and the drug which inhibit alcohol dehydrogenase inhibitor is fomepizole. So fomepizole is an alcohol dehydrogenase inhibitor. Hence again, this option is true. So the false statement we all know is A. So incorrect statement is A. Now let's understand incorrect statement. Now what is LMWH? LMWH stands for low molecular weight heparin. Remember, heparin is a very acidic molecule, highly acidic molecule present in the body. But there are two other forms of heparin as well. High molecular weight heparin and less than lower will be ultra low molecular weight heparin. Okay, ultra low molecular weight heparin. So we can write the short forms. So we can write the short form HMWH, high molecular weight heparin, low molecular weight heparin, and ultra low molecular weight heparin. Now remember, for their poisoning, high molecular weight heparin, the antidote is protamine sulfate. Because protamine sulfate is a highly basic molecule which will attach with highly acidic molecule, high molecular weight heparin. Low molecular weight heparin is less acidic. So protamine sulfate partially reverse the effect of low molecular weight heparin, and protamine sulfate has no effect on ultra low molecular weight heparin. So can you tell me protamine sulfate will be an antidote for high molecular weight, low molecular weight, or ultra low molecular weight? Protamine sulfate is an antidote only for high molecular weight heparin, not for low molecular weight heparin and ultra low. So this is a false statement. Agree? So this is about pharmacology. Thank you very much.